Good evening, everybody. Welcome to our newsroom, March 16, 2020. This is a media release or immediate release. Cold Lake First Nations public buildings closed to all non-staff amid COVID-19 pandemic. Effective March 16, 2020, all public buildings on Cold Lake First Nations will be closed to all non-staff individuals until further notice. This decision was approved by Chief and Council in correspondence to the Alberta's government decision to close all schools and daycares in the province for the remainder of the year. This decision comes as the number of confirmed cases of COVID-19 in Alberta climbed to 56. Cold Lake First Nations will continue to deliver essential services to members regularly and on schedule. This includes public works, water delivery, waste management, etc. Health services and social services. Individuals who are requiring services are encouraged to call ahead and can expect to be screened prior to being allowed into the buildings. Chief and Council have also appointed an acting Director of Emergency Management and a Deputy Emergency Management. Emergency Management team will be housed at the Elders.
Actually, I think that's been changed.
It's been changed to the band office, something with the hot water there. No hot water at the Elder Center, so it's going to be at the band office. A call line will be set up to field questions and concerns from community members. Information on this call line will be released as soon as it is set up. So we're going to be set up tomorrow, and when we set it up, we'll give out the numbers and whatnot so members can phone in. And Cold Lake First Nations encourages all community members and residents to practice preventable health measures and social distances where possible. For more information on these measures, please visit Alberta Health Services webpage at www.albertahealthservices.ca/topics, page 16997. This is truly unprecedented times, and it's in these times that we as leaders need to put the health and well-being of our members as our top priority. That's what the chief stated, and I'm here to let the people know what we're doing, and I brought Lillian in here to talk, maybe answer a few of my questions there. We put this in place because there's a few community spread cases now.
Yeah, so yesterday, for any of you who were able to watch the update from our Chief Medical Officer of Health, we were told that there had in fact now been documented community-acquired transmission with COVID-19. So that's why you've seen the efforts more aggressively put forward by the Alberta government in closing our schools, our daycares, and our Head Start facilities. It's so that we can try to get ahead of this COVID-19, this pandemic, and try to, I guess, flatten what they're calling flatten the curve. So we do know that this virus responds very well to isolation. And so the more that we can isolate people, the more that we can keep people from gathering, the less degree that this is going to spread throughout the community. And so that's why you've seen the actions taken both by the Alberta government and now by your local government, meaning Chief and Council. So yes, we met with all of our team today, all of our managers and program managers, our Chief and our Council, and some decisions were made today in regards to the safety of our community members, in regards to the safety of our staff, because we also have to put their safety as a primary concern. We do have some limited staff in areas of our essential services, so it's important that we keep those staff members as healthy for as long as we can in order that we can fulfill those obligations with essential services. So going forward, you as community members will notice that when you come to a public building such as the band office, social development, or health services, that the doors will be locked. Now, the doors are not locked to keep you out, but what they're doing is they're allowing us to screen you before you come into the building. And so you'll be asked some very specific questions. And some of those questions are going to be, are you today having a cough, a fever, a runny nose? Are you feeling flu-like, or are you feeling really tired? And so that's one of the questions that we're going to put out to you. We're also going to ask you if you have traveled outside of Canada within the past 14 days, or if you have been a contact of somebody who has traveled outside of Canada within the past 14 days. And so if the answer is yes to either of those questions, we will actually send you back home. So that's why we say it's actually best to call ahead and let us know what your needs are, because chances are we might be able to meet those needs without you having to come all the way into the public buildings. All of our staff will be trained on how to go through the algorithm for 811. So last week, if you remember, I gave the number 811 out as directed for you guys to call if you have questions about COVID. Having tested that system myself, and from several of our staff members who have tested that system, I can tell you that they are overwhelmed with the amount of phone calls from all Albertans. And so one of the mandates that we put forward with Alberta Health and through FNIB was that we wanted access to the screening tool that was being used by 811 so that we could better serve you and answer your questions. So indeed, that tool has actually been made available to us, and it's actually been made available to you as well. So if you go to www.alberta.ca and you click on the coronavirus webpage, you will actually see a COVID-19 self-assessment tool. And this tool, if you click on it, will run you through a series of questions, and they're the same questions that you would be asked should you get through to 811 and speak to a nurse. And so these self-assessment tools basically ask many of the same questions that I just put out there. And depending on how you answer those questions, you will either be directed to self-isolate at home, to seek 911 or call 911 if you're in serious respiratory distress, or simply just stay home and maintain those social distancing measures and remember to wash your hands. So I can tell you that a lot of the phone calls that we've gotten today have been, a lot of anxious people in our communities, and I totally get that. We are dealing with a pandemic. This is kind of a new reality for all of us. And so we're trying to work our way through that the best that we can. But remember as well that this pandemic in particular is still, for most people, just the sniffles, okay? So don't panic. If you have a cough or a cold, if you're able to manage at home, we want you to manage at home. So instead of running out, like last week, we kind of joked about the toilet paper, Kelsey. We kind of laughed about the people running out and buying toilet paper in a big rush. Well, if you really want to prepare for this virus and prepare your family at home, I suggest actually maybe getting some of those comfort measures that are going to make you feel better if somebody does get sick. So an instance in my household, I made sure that I had cough syrup on hand, that I had some Neocitrin in hand, that I have Kleenexes if I need to blow my nose in case I do get sick. But those are more adequate, I guess, provisions when we're going into a pandemic instead of just toilet paper. As well, I really want to reach out to our elderly population at this time, Kelsey. What we do know about this virus, and what I have been telling to a lot of our people, is that we need to protect our elderly. So it's not so much the young people that are affected by this virus, as to most of the time they just get a cough or a cold or just a general flu symptoms that they'll get over very quickly with. However, if you are an elderly individual, and I'm talking those over the age of 60 years old, if you have any comorbidities, meaning that you have high blood pressure, if you have diabetes, if you have had cancer in the past or are currently dealing with cancer, if you have COPD, chronic obstructive pulmonary disease, or even if you're a smoker, your risk of having more severe symptoms with COVID-19 is greater than the general population. So because of this, I want to reach out to our families out there to ensure that they're protecting their elderly, meaning that you're cognizant of the people that you're bringing into your home. I need you to be cognizant of the people that you're around on a daily basis. Try to use that social distancing to protect yourself, which inevitably will protect your elders at home. Okay, and this is a time for our community to really come together. Families will need to rely on one another to ensure that they're meeting the needs of their own families. So meaning that they need to be able to, if an elderly person is at home, making sure that you're the one going out and doing the shopping for that elderly person, okay? Make sure that we protect them and keep them at home and keep them as isolated from the general population as possible, and that's our best advice going forward. And of course, if you yourself do leave the home, I really encourage you, soap and water. Make sure that you're washing your hands while you're out in the public frequently, and make sure you wash your hands when you come back home. That's probably the most important piece. So soap and water is best. It's the most effective against this virus, even more effective than hand sanitizer. Soap and water, 20 seconds, washing your hand vigorously. Sing a song if you have to, but make sure you're washing them for a full 20 seconds. And that's pretty much it.
Okay, so I just want to know about the social distance and how far should I keep away from everybody?
So social distancing, we're asking you to stay about 2 meters.
Okay.
So just kind of trying to observe a personal space of about 2 meters.
Okay.
Because what we do know with the virus is that it's not an airborne virus just because we're breathing in the same space. It's not passed in that way. How it is passed is if I actively cough into the environment or sneeze into the environment and it lands on the surfaces, and then somebody else can actually come along and pick that up. We don't completely know how long the germ is active on surfaces, and so this is why you see us ramping our efforts up around the nation. We've actually hired a few more cleaners in our public buildings to ensure that all those surfaces are being wiped down multiple times a day. We've put them all through training today to make sure that they are all up on the latest and greatest in environmental cleaning specifications. And we've also done some training around PPE, so personal protective equipment for them. So again, we have to protect our workers just as much as we have to protect our general community.
So not gather at all, period.
Yeah, so the Alberta government put some regulations in place where they're saying, no more than large gatherings, more than 250 people. I do believe now that they're gone down to 50 people.
I think it was 10 people actually.
Yeah, so we've gone a step farther here in the nation, and we've decided that there's no gathering that's worth risking the lives of our community members or our elders. And so all of those extracurricular activities that, the health center does, the youth coordinators do, so any of our youth and recreation extracurricular activities have been postponed. All of our elders gatherings, so we usually do an elder social over at the health center, that has been postponed until further notice. As well as our diabetes socials, our Healthy Hearts clubs. So any of those extracurricular activities that normally happen will be postponed just in order to keep the risk down for our population. So if it's unnecessary, we don't need to do that.
Okay, what about families? Is it a good idea they have a plan together?
Absolutely. Absolutely. I think that this is a really good time for you guys right now to come together as a family. Now, whether that be in one household or a general family, because I know that some of our families are very large and spread over many households. I would suggest to you that you actually have a meeting with your families and talk about, who's going to be doing the shopping for you when you go out in public. And again, just to minimize that risk, who's going to be delivering that food to your elderly person who may be in that family. Talking about your plan B. What happens if we get a next set of rules or a next set of rules? So just looking at how things may change in the near future, talking about some possibilities, and talking about how you can keep your family safe. And that's the most important thing, is that we want to make sure that our families stay healthy and safe within our community.
Okay, I have concern. Some of our houses overcrowded and whatnot. Yes. Say we're in 14-day in quarantine, we're in the middle of it. Then another family member starts getting symptoms and whatnot. Do we start over the quarantine?
Yes, you do.
Oh, okay.
Yeah. Because you have been then exposed to somebody in the household. And so remember as well, we are actually in a really good place here out in Cold Lake, and that even though we're told to self-isolate, you can still send your kids outside to go and play. Okay, you yourself can still go out for a walk, and it's good exercise, and it's good for your mental health as well. So we really encourage that you do that. And just try not to gather in big groups. That's what we're asking.
They're talking about shutting borders down, but we're a border city. Is it possible, do you think?
I guess we'll see going forward, right? I would suggest, though, that if you have a lot of family on the Saskatchewan side of the border, that you just encourage your family to remain in their own communities for your safety and for their safety as well. We have kind of a unique community here in Cold Lake in that we have our air base, right? And so we do have international travelers coming into this community quite a bit, which kind of helps to tick up our risk. So that being said, just encourage your families to really stay where they're at.
So basically everything has been put on hold now, and we're going to try to wait this out and see what happens. And no bingo. You know, I know no bingo. Try to stay away from bingo. And I know Premier is going to be making an announcement. So we're going to bring up everything up to speed. You know, we're going to have a call number tomorrow so our members to get out. But once that number is set up, we're going to have it. And when people's mandated, we can answer the questions. So I don't know how much I can add on to this. You know, it's a very serious time and we have concerns. So we're stepping up the efforts. So, and
did I happen to mention, if any of you out there are experiencing any serious anxiety, you know, or your kids are experiencing a lot of anxiety, you can reach out to the mental health helpline, which is available 24/7 here in Alberta. Their number is 1-877-303-2642. I do encourage you to touch base with them from time to time and just talk about some of the issues that you might be having in your household or in your family. You know, people deal with stress differently, and to recognize that within your own family members, sometimes people will get short-tempered. Some people will get really quiet, and other people will lash out. So realizing that people cope differently under stress is important, and learning how to cope in a healthy way is also very important.
And is all the other emergency facilities open right now? Say a fire, or say if I had a heart attack or something?
Absolutely. All the emergency and essential services are still operating as normal.
Yeah.
Again, we encourage people, if you don't need to be out and about, we don't encourage that you go to the hospital unless you absolutely need to, meaning that it has to be urgent in nature. Our emergency medical staff are under a lot of stress right now. We are also asking that if you have appointments booked, so let's say you have dental appointments, you know, just for normal dental therapy, if you have normal eye appointments booked, any appointments that are non-urgent, I would actually ask you to cancel those appointments to a future date. We are actually looking at trying to do something with our medical transport drivers where they may only be able to focus on our specialist appointments. And so going forward, you might notice that you might not necessarily have a ride to those appointments as well. So again, keep abreast of the changes that we're making. There are changes made every day. Look to the website and find out the newest and latest information from our medical officers of health. That announcement will be coming out at 4:30 today, where I'm sure those numbers will change again. And we will try to keep you as informed as we can.
So stay away from hospitals, call 811, and on emergencies, call 911.
Only if you're experiencing a true emergency. So if you're having respiratory distress, meaning that you are having difficulty breathing, then you can call 911.
Okay.
Okay.
So we are very ahead of the situation, and everything we are doing is precautionary. You know, don't panic. You know, maybe sometime get your mind off things, make some bannock, or do some other activities or whatnot. You know, me and Izzy used to do that. We never had nothing before, and we managed, and we're still here today. So, prayers out to everybody, and let's get through this.
And we'll get through it together.
Yeah, Masi. Thanks for coming in, Lillian.
You're welcome.
Okay.